Professionally, my background is a medical doctor, and I realized that I had a medical problem when I gave birth to my baby, and after a few months, that's when I started having severe low back pain, numbness, and I couldn't walk the usual distance that I used to. I couldn't carry things. So I visited a hospital back in Tanzania. So I did a physiotherapy and I was on those analgesic for about a year. And then after a year, I did another MRI. That's when I realized that the problem is not going away, but also the symptoms were persisting. So that's when I did all the consultations from different surgeons, and fortunately, I landed to Dr. Krishna. So he really makes the patient comfortable to understand what the patient is suffering from and which kind of procedure will take place. I was admitted. I went for surgery, and after like 12 hours, that's when I first opened my eyes, and I tried to stretch my legs. When I saw my legs were moving, I was like, okay, everything went well. I thank God, because there was no nerve damage.
She had typical symptoms and signs and radiological findings suggestive of what we say grade 3 spondylolisthesis of L5 over S1 due to a congenital lytic listhesis. So to say, it is the spine, the L5 vertebra, instead of being in alignment with S1 vertebra, whenever she would stand up or in certain forward bending position, instead of being like this, would slip forward so much. It would get locked there. The whole body would go into spasm starting from the lower back. In addition, when the spine itself moved, the spinal nerves would also stretch. And she was extremely lucky that she didn't have a major neurological deficit, because it's a congenital thing, and body, because of elastic tissue, she has been suffering pain, but it is tolerated. But of late, the tolerance of injury was coming down. Next step would be developing a neurological paralysis. Especially in a lady, a grade 3 spondylolisthesis not only affects the nerves which are coming down to both the legs, but also to very, very important function of control of bladder and bowel. And we suggested this surgery wherein we would open her back, spine and muscles and release all the tissues which are abnormally developed, and then release the nerves which are getting stretched and pull back the spine to their normal position using what are known as pedicle screw systems. Screw and rods, where using a cantilever technique, the slipped vertebra is brought back in alignment with the rest of the spine. Then we placed between this, then we drilled out all this bone through in between the nerves, protecting the nerves using a very high speed drill. And then we put a special material cage made of polyether ketone with a titanium plates on either side, which would go inside, and then we can expand it to exact fit. Because there is no scope for putting exact size, because it will not go in. If you go put exact size, it will become loose inside. You can't oversize it because you cannot stretch the thing anymore, because it's already stretched card. So these are new devices which help us. So we have to place one which is slightly smaller, but inside as it goes, then we can expand the cage itself. So this is the device that has been put with supports. So patient is comfortable post-operatively, so much so that after this extensive surgery, she could walk very next day morning. She has absolutely no neurological deficit. Of course, it's every spine surgery, we must aim at preserving 100% patient and make them functional.
One thing that everyone should know, a spondylolisthesis medical problem is treatable. So I really recommend the team at Apollo, and I'm grateful, and I congratulate the management and all the staff at Apollo Hospital.